Over the next day and a half, you're going to hear presentations about KDIGO's work and things that are happening currently in several fields that we're very interested in. And we want you to take these pieces of information and pieces of reference from KDIGO back to your institution and especially back to your patients.
So kidney disease is estimated to affect up to 800 million people worldwide. Between 30 and 40 million of Americans have kidney disease, depending on how you look at it. KDIGO's purpose is best expressed through its mission statement: improving the care and outcomes of patients with kidney disease worldwide through the development and implementation of global clinical practice guidelines. So here we've gotten together in Alexandria for a clinical practice conference, and it's really the first implementation activity on this scale that we are conducting in the United States. And so this is really the first opportunity for us to talk to key opinion leaders who may, be top in their field, but not necessarily have had much contact with KDIGO previously.
Our patients with progressive renal dysfunction, whether they choose to pursue dialysis or a non-dialytic conservative pathway, that they're suffering from a lot of symptoms.
We don't want the patient to get hyperphosphatemic, so we are going to take some actions. But in those earlier stages, the compensatory mechanisms of the kidney seem to keep the serum phosphorus at a reasonable level.
The fact that people react to hyperkalemia so much and cut down all the medication is actually the right thing to do because that's what the guidelines tell us. First do no harm. If somebody's potassium is 6, there's no reason to continue.
But several observational studies from Europe and also from the US showed that things might have changed a bit, and the real epidemic now is low PTH, and the impact of increasing PTH or mortality risk is not so extreme.
And so over the past 2 days, we've heard about glomerular disease by 2 international experts. We've heard about pruritus, we've heard about mineral bone disease, anemia, hyperkalemia, all topics that have been very prominently featured among KDIGO's conferences and guidelines over the last several years.
I'm going to base my talk on 3 case studies which illustrate 3 aspects of iron deficiency in CKD.
Acute management has not really changed. However, the chronic management, I think, is a much more important issue as we look to focus on strategies to enable better use of guideline-based medical therapy in people with kidney disease and heart disease.
In the US, especially in our dialysis units, we're hit with these metrics, quality metrics. Within our system, I think it's very frustrating when we have our guidelines and clearly what we're being monitored and actually hit against for our patient care is completely opposite.
KDIGO has built a large network of professionals in the kidney health space over the last 10 plus years. And whenever we require colleagues to step up and to participate in our activities, to attend our conferences, to serve as speakers, we rarely need to ask twice.
When you use the word absolute iron deficiency, you also imply a differential diagnosis of cancer, bleeding, of GI problems. And that means you medically must follow up.
Is there a vintage effect? Are there effects in Germany? Perhaps they do more hemodiafiltration. Could that be an effect? What about populations like nocturnal dialysis populations?
We can't talk in medical speak. We have to bring it down to their level. We have to find out what their goals are and somehow allow them to see how this mineral in excess can affect their goals.
People are extremely engaged, are extremely willing to donate their time to KDIGO. And I think one of the reasons that is the case is they have firsthand witnessed the depth and the honesty of the discussions that are being held and the value of the materials that KDIGO develops for the practicing nephrologist in their clinical settings. But it's really amazing how palpable this desire, this passion is about improving kidney health. And that's something that really unifies the KDIGO family.